Hello, I'm Dr. Chong. I'm one of the colorectal surgeons here at Paragon Surgical Specialists, and I was going to talk to you guys today about diverticulitis. It's a very common problem I see in my practice, and it's actually getting more and more frequent in our population, and there's some of the things that you guys can try to do at home to prevent further attacks. Now, to begin, diverticulitis really stems from the outpouching of the colon, and it begins with inflammation and can potentially lead to infection of these little pockets. It's mostly found in elderly patients. However, there is a shift towards the younger population, even in the short amount of time I've been here. In terms of symptoms and signs that you would notice, it would be pain in the abdomen, mostly on the left side, and some patients can also have some pelvic discomfort. There may be association with changes in bowel habits, such as constipation or diarrhea, and it can also lead to urinary problems. If you have any signs and symptoms such as this and have worsening fevers and chills, then you definitely need to come to the hospital for further evaluation. So some of the things you can do at home when you notice sudden onset of this type of pain is change your diet immediately. Changing your diet to a soft food or even a liquid diet for a couple of days would help. The best way to think about it is you don't want to stress the colon even more. So you want to make sure that whatever you put in can come out easily. Making sure that you are not constipated and taking over-the-counter medications for pain control. And in terms of what I would do as a surgeon is, after a thorough evaluation, then the surgery for this would involve removing a portion of the colon. I tell all my patients that I'm really just a fancy plumber. I have to remove the bad piping and find two good ends of the pipe and hook them together. In terms of postoperative care for surgery after diverticulitis, it really depends on the surgery that you underwent. I try to do all my surgeries laparoscopically or robotically, meaning with little poke holes. However, if at any point in time it's unsafe, then I would have to make the bigger incision. And the healing part obviously is a little bit different. With the minimally invasive techniques such as laparoscopic or robotic, patients usually feel pretty well by the time they go home and are able to do a lot of the household activities they used to do within a 2-week time period. And by the time I see patients in follow-up at 2 weeks, most of them say that they are virtually pain-free. On the other hand, with an open technique, then those patients will report a little bit more pain, obviously with a larger incision, and they would have to refrain from heavy lifting for a total of 6 weeks to prevent other sort of postoperative complications such as a hernia.